I'm actually from Kolkata. I shifted to Hyderabad in the year 2010. I shifted with my family, my mother and my sister. And my sister, when she came here, she got admitted to a college. Her name is Namrata Bhattacharya. She got admitted to a local college. She was doing her degree course out here. Initial days, after shifting from a different climate to this climate, it took adjustment. It took a toll on her body, and somehow he contradicted jaundice even within 3 to 4 months when she shifted to Hyderabad. And we initially went to a local, allopathic doctor, allopathic clinic, and she recommended few medicines initial days, and she was not recovering from it. She was admitted to the hospital for a week, and after she came back, she was completely on a controlled diet, everything boiled. No oil, no spice, nothing. Even she was on a controlled diet. We took an LFT after 2 weeks. After taking LFT is liver functional test, and we saw that the bilirubin level, the SGPT, SGOT level, they were not getting down. So we had, I was struggling because I had my office, my mother was alone here, so we were taking proper care. Care as in a case of a jaundice patient, you take a care of controlling her diet. Even with controlled diet and no physical activity, she was not recovering, because when we went to the allopathic doctor, she said that it would be only diet can fix this disease. There is no Western medicine which can cure this disease. Then I came across a friend of mine from Hyderabad native. He suggested me Kamalahar, and then I went to the website and I bought Kamalahar, 2 files of Kamalahar. I think it's 60 capsules each, so each file. So I was very circumspect because I never had tried any ayurvedic medicine before in my life. Not did my family did. So I was circumspect, but I went ahead and I ordered the bottle, and she started taking 3 capsules every day after meal. At that point of time, she was hardly taking any food because the diet, your appetite dies when you have jaundice. So once she started taking, miraculously, within a week, we were still consulting the allopathic doctor, but we didn't disclose that we were taking Kamalahar to her. But within 1 month, of allopathic treatment, she did not get his bilirubin or SGPT down. But with 1 week of Kamalahar, her SGPT level and SGOT level came down. Her bilirubin came down from 4.5 to 2.5, and after that we went again for a test in another 15 days, and she was completely normal. Her bilirubin came down to 1.2. The doctor told that anything below 1 or near 1 is normal. So it took a recovery. Within even 1 file of the capsule wasn't over. He was still on the first file of the capsules, and she made a recovery still then. And what we did is, I called Mr. Karote's number, and he suggested that she should take another couple of files just to be sure. So she had 3 files of Kamalahar thrice a day, and the diet was, from the very beginning, we were practicing a very tight diet for her. We were not giving any oily food or spicy food. Even during the consumption of Kamalahar, we stick to that diet, and we did not give her anything else than that. Okay. So that was the story behind how she recovered, because we tried everything in the world of allopathic medicine, and nothing was happening. And there was a phase where she was recovering, and it went back high, and that's the time when I decided to go for Kamalahar. So her bilirubin level and the SGPT, SGOT level went high from 2.5 to 4. At that point of time, we decided that it's high time we do something else. So that's it's been 1 year, over 1 year now. She's pretty good. At least her liver is pretty okay now, and we do monitor her LFT levels, liver functional test every other month. So she's pretty good since then.
Okay.